Picture this. Your cat has a respiratory infection. The veterinarian hands you a small orange prescription bottle. They smile and say the words that every cat owner secretly dreads hearing. Just give one pill twice a day for 10 days. Just. You go home. You feel confident. How hard can it be? This is a 4-pound animal. You outweigh them by approximately 35 times. You open the bottle. You walk toward your cat with the pill pinched between your fingers. And something ancient and terrifying wakes up inside your perfectly sweet, normally gentle house cat. They see you coming. Their pupils blow wide open like 2 black moons. Their ears flatten completely against their skull. Their entire spine drops 2 inches as their body shifts into something that no longer resembles the creature that was sleeping on your chest 20 minutes ago. You make your move. What happens next is something between a nature documentary and a kitchen disaster. There are claws. There are sounds. There is a small orange pill that disappears somewhere under the refrigerator and is never seen again. There is blood. Specifically yours. You stand there in your kitchen, breathing hard, holding your scratched hand under the cold tap, and you stare at your cat who is now sitting 3 feet away from you, completely composed, licking their paw like absolutely nothing happened. And you think one thought. I have to do this again in 12 hours. If that scenario lives in your body as a real memory, you are not alone. Medicating a cat is consistently ranked as one of the most stressful experiences in pet ownership. Not because cat owners are doing it wrong, but because almost every cat owner is starting at the wrong point entirely. There is a step that comes before the pill, before the butter, before the treat, before any technique or tool or trick you have ever read about online. It is the step that veterinary staff use every single time before attempting any medication with a difficult cat. And the overwhelming majority of owners never know it exists. Please put down whatever is stressing you out right now and take one slow breath. Hi everyone. I am Dr. Maya Reeves, and welcome to Paw Secrets Lab. For the past 13 years I have worked as a feline specialist veterinarian. Which means cats are not just part of my practice. They are my entire practice. I have medicated thousands of cats across hundreds of breeds, temperaments, and trauma histories. I have met cats that made grown veterinary technicians genuinely nervous. And I have learned something that changed the way I approach every single difficult medication case. The problem almost never starts with the pill. It starts 30 seconds before the pill ever appears. Today I am going to give you everything. In Chapter 1, I will explain the feline threat detection system and why your cat begins rejecting medication before you even open the bottle. In Chapter 2, I will reveal the veterinary pre-medication protocol, the exact sequence of steps that vet staff use before attempting to give any medication to a resistant cat. In Chapter 3, I will walk you through the Burrito wrap and scruff-free restraint method, 2 techniques that protect both of you without destroying your relationship. And in Chapter 4, I will give you the complete feline-safe flavor masking system, the specific foods and textures that work with a cat's biology instead of against it, and the ones that could genuinely harm them. Subscribe to Paw Secrets Lab right now to join our community of educated, empowered pet parents. Get something to write with. Because by the end of this deep dive, medicating your cat is going to feel like a completely different experience. Let us begin. To solve this problem completely, we cannot start with the solution. We have to start with the science of what is actually happening inside your cat's nervous system the moment medication becomes necessary. Because here is what most owners do not realize. Your cat does not hate the pill. Your cat does not even know what the pill is yet. What your cat hates is everything that happened in the 30 seconds before the pill appeared. And their brain has been building a case file against you since the moment you opened that prescription bottle. Here is why. Cats are what behavioral scientists classify as solitary obligate predators with no pack hierarchy. Unlike dogs, who evolved alongside humans in cooperative social structures, cats evolved as both predator and prey simultaneously. A cat in the wild hunts alone, and a cat in the wild is hunted alone. This dual nature produced a nervous system of extraordinary sensitivity. A cat's threat detection system operates on what neuroscientists call a hair-trigger sympathetic response, meaning the distance between completely relaxed and full fight or flight activation is measured not in minutes or seconds, but in milliseconds. And the triggers are not what you think. You believe your cat reacts to the pill. But their nervous system is actually cataloging a sequence of environmental data points long before the pill arrives. It starts with your energy. When you know you have to medicate your cat, your body changes. Your breathing becomes slightly shallower. Your movements become slightly more deliberate. Your heart rate elevates fractionally. You may not feel any of this consciously. But your cat, whose sensory apparatus is calibrated to detect the micro-movements of a mouse under 6 inches of snow, detects every single change in you with absolute precision. To their nervous system, you are not their owner approaching with medicine. You are a larger animal moving with unusual intentionality. That is threat signal number 1. Then you pick up the pill bottle. The sound of tablets shifting inside a plastic container is not a sound that exists in nature. It is novel, it is rattling, and because your cat has already been conditioned through previous medication attempts to associate that sound with restraint, discomfort, and loss of control, it has become what behaviorists call a conditioned aversive stimulus. That is threat signal number 2. Then you make direct eye contact and move toward them. In feline social language, direct sustained eye contact combined with forward body movement is not affectionate. It is confrontational. It is the exact posture a predator assumes before closing distance on prey. That is threat signal number 3. By the time you are standing 2 feet away from your cat with a pill in your hand, their sympathetic nervous system has already fired. Adrenaline is flooding their bloodstream. Their muscles are primed for explosive movement. Their claws are ready. Their jaw is ready. You have not done anything wrong yet. But in their nervous system, the threat has already arrived. This is why force almost never works long term. Because every time you attempt to medicate a cat who is already in sympathetic activation, you are not just giving medicine. You are running a conditioning trial that teaches their brain to escalate the threat response earlier and earlier in the sequence. The cat who first tensed up when they saw the pill bottle now tenses up when they hear you open the medicine cabinet in the other room. The cat who first struggled during restraint now runs and hides the moment they see you walking with purpose toward the room they are in. The threat detection system learns. And it learns fast. So how do we stop triggering it before we even begin? This is the chapter that changes everything. Because what I am about to share with you is not a pill-giving trick. It is a nervous system reset sequence. And it happens before the medication ever enters the picture. At my clinic, before any veterinary nurse attempts to medicate a difficult cat, they follow what I call the pre-medication protocol. It has 5 steps. It takes approximately 4 minutes. And it increases successful first-attempt medication rates in resistant cats by a margin that would genuinely surprise you. Here is exactly what it looks like and how you replicate it at home. Pre-medication Step 1. The environmental reset. At least 15 minutes before you plan to give medication, you change the environment without changing your behavior. You do not look at the cat differently. You do not move toward them. You simply make the room quieter. You lower any screens. You dim any harsh overhead lights if possible. You sit down on the floor or on furniture at their level rather than standing above them. You are not interacting with the cat yet. You are simply removing environmental noise from their sensory fields so their baseline arousal level begins to drop before you do anything else. A cat that enters the medication attempt at a baseline arousal level of 3 out of 10 is a fundamentally different patient than a cat entering at 7 out of 10. You are engineering a lower starting point. Pre-medication Step 2. The slow blink sequence. Once you are settled and the environment is quiet, you find your cat with your eyes without moving your body toward them. You make soft, relaxed eye contact. Not the fixed, focused stare of intention. Soft eyes, slightly unfocused, the way you look at something you are not really looking at. And you slow blink. You close your eyes slowly, hold for 1 full second, and open them again slowly. This is not a trick or a folk remedy. This is documented feline communication. Research published in scientific reports in 2020 demonstrated that slow blinking by humans produces affiliative responses in cats, specifically the slow blink response, which is the feline equivalent of a relaxed social smile. You are speaking directly to their nervous system in its own language. You are saying, I am not a threat. My body is not tense. There is no danger here. Do this 3 to 4 times. If your cat slow blinks back, their arousal level just dropped measurably. If they look away and begin grooming, that is also a positive signal. Self-grooming in cats indicates a downshift from alertness toward comfort. Premedication Step 3. The scent introduction. This step specifically addresses the pill bottle problem. 24 to 48 hours before a new medication course begins, you introduce the pill bottle into your cat's environment without using it. You set it on the coffee table. You let it sit on the floor near their feeding area. You let them sniff it on their own terms with zero pressure and zero consequence. You are deprogramming the conditioned aversive response to the object before it becomes a problem. By the time you actually need to open that bottle, it is no longer a novel threatening object. It is furniture. It is background. It has lost its power as threat signal number 2. Premedication Step 4. The touch gradient. Before you attempt any form of restraint, you spend 60 to 90 seconds performing what we call a touch gradient. You begin at the safest touch zone for most cats, which is the base of the skull just behind the ears. You use slow, firm, circular pressure. Not light scratching. Firm, intentional contact that activates the pressure receptors in the skin and triggers a parasympathetic calming response. Gradually, over 60 seconds, you move your touch toward the scruff area and down toward the shoulders. You are not restraining. You are mapping the pathway your hands will need to travel and conditioning calm responses along the route before any restraint is necessary. Premedication Step 5. The neutral voice anchor. Throughout this entire sequence, your voice remains completely neutral. Not sweet. Not coaxing. Not the slightly higher pitched, "It's okay, baby," voice that well-meaning owners use. That voice change is detectable to your cat, and it signals anxiety, which signals threat. Use your normal conversational tone. Speak in complete, unhurried sentences if you speak at all. The content does not matter. The emotional flatness of the delivery does. You have now spent 4 minutes bringing your cat from a potential arousal level of 7 down to a 2 or 3. You have addressed their threat detection system before it activated. And you are now ready to actually give the medication from a position of genuine calm on both sides. Even with the perfect pre-medication protocol, some cats require physical restraint during medication. And the way you restrain a cat is the difference between a technique that works once and a relationship that survives intact. I want to address the scruffing debate directly. Scruffing, gripping the loose skin at the back of the neck, is a restraint method that has been used in veterinary practice for decades. Current behavioral science is moving strongly away from this technique for awake, conscious cats in non-emergency situations. While it does trigger an immobility reflex in kittens, adult cats show significant stress responses to scruffing that can intensify over repeated use and deepen negative associations with handling. Unless you are facing a genuine emergency, scruffing is not your first choice. Your first choice is the burrito wrap. The burrito wrap method: take a large, thick towel, bath towel weight or heavier. Lay it flat on a non-slip surface, a countertop with a rubber mat, or a carpeted floor. Place your cat in the center of the towel in a natural sitting or crouching position. Do not force a position. Simply guide them onto the towel center. Take one side of the towel and fold it snugly over their body, tucking it gently under their opposite side. Then take the other side and fold it across, creating a secure but not tight wrap around their entire body, including their front legs. The key word is snug, not tight. You are creating what behaviorists call pressure therapy, consistent gentle compression across the body surface that activates the parasympathetic nervous system and reduces arousal the same way weighted blankets reduce anxiety in humans. A properly wrapped cat will often go almost still within 20 to 30 seconds. Not from fear. From the genuine calming effect of even, distributed pressure. With their body secure in the wrap, their head is exposed and their mouth is accessible. One hand maintains gentle but firm contact at the base of the skull to stabilize the head. The other hand delivers the medication. For pill delivery specifically, tilt the head back slightly until the nose points gently toward the ceiling. The jaw will naturally relax slightly as the throat straightens. Place the pill as far back on the tongue as possible, past the point of the taste receptors at the tongue center. Close the jaw gently, and immediately stroke the throat downward with one finger in a single slow motion. This activates the swallowing reflex. Keep the nose gently elevated for 10 seconds. Blowing a small puff of air toward the nose will also trigger an automatic swallow reflex in most cats. Follow immediately with a small syringe of plain water, approximately 1 milliliter, to ensure the pill moves fully through the esophagus. Cats are at genuine risk of esophageal ulceration from pills that lodge in the esophageal tissue without adequate moisture to carry them through. This is not optional. It is a medical necessity every single time. Now I need to give you the complete picture on hiding medication in food. Because the rules for cats are significantly different from dogs, and getting this wrong carries real medical risk. Cats are obligate carnivores with a flavor detection system that operates completely differently from dogs or humans. They cannot detect sweetness at all. Their taste receptors are calibrated almost entirely toward amino acids, fat, and specific savory compounds found in animal protein. This means the cheese, the peanut butter, the bread, the sweet potato, all of the go-to pill-hiding foods for dogs, are completely useless for cats, and some are actively dangerous. Here is your safe flavor masking list and your danger list. Safe flavor masking options for cats. Option 1. Pill pockets designed specifically for cats. The texture is soft enough to fully seal around a pill, and the flavor profile is calibrated to feline taste receptors. These are your most reliable option for cats who are food motivated. Option 2. A small amount of plain canned tuna in water. Not oil. Not brine. Water-packed, plain tuna with no added salt. Mash the pill inside a small piece and offer it directly. The extremely strong amino acid scent profile of tuna is one of the few food smells powerful enough to compete with the chemical scent of most medications. Option 3. Plain cooked chicken breast shredded. No seasoning. No garlic. No onion. No oil. Wrap the pill tightly inside a small pinched bundle of shredded chicken and offer it at room temperature rather than cold, as warming slightly amplifies the scent signal. Option 4. A tiny amount of plain unsalted butter. Same mechanism as with dogs, the fat creates a physical scent barrier and provides esophageal lubrication. Appropriate for occasional use in cats without known pancreatitis history. Not for long-term daily use. Critical danger list for cats. I need to be completely direct with you about this section because these are not minor considerations. These are genuine medical emergencies waiting to happen. Danger 1. Any food containing onion or garlic in any form. Onion and garlic, including powdered versions that appear in many broths, baby foods, and deli meats, contain compounds called thiosulfates that cause direct destruction of feline red blood cells. The resulting hemolytic anemia can be fatal. Even small repeated exposures accumulate. Read every label. If you see onion powder, garlic powder, or natural flavors in a savory meat product, do not use it. Danger 2. Tuna in oil or brine. High sodium content in brine-packed tuna causes significant kidney stress in cats whose renal systems are already delicate. Oil-packed varieties contribute unnecessary fat load. Water-packed only, and only as an occasional medication aid, not as a dietary supplement. Excessive tuna consumption also contributes to vitamin E deficiency in cats over time. Danger 3. Dairy products beyond small amounts. The overwhelming majority of adult cats are lactose intolerant. Their digestive systems stop producing sufficient lactase after kittenhood. A small scrape of plain cream cheese occasionally to hide a pill is manageable for most cats. A spoonful of milk or yogurt added to their bowl is a reliable way to produce gastrointestinal distress within hours. Danger 4. Crushing the medication without veterinary guidance. This applies equally to cats and dogs but carries a specific additional risk in cats. Many feline medications are formulated as extended-release capsules or film-coated tablets specifically because the cat's stomach acid is significantly more concentrated than a dog's. Crushing these medications destroys the delivery mechanism, exposes the active compound to immediate acid destruction, reduces or eliminates therapeutic effect, and in some formulations creates a concentrated local chemical burn on the stomach lining. Always call your veterinarian before altering any tablet or capsule. I know what the last 10 days of twice-daily medication feels like when your cat has decided you are the enemy. I know the way it changes how you walk into a room. The way you start calculating which door to close first. The way you look at your cat sleeping peacefully on the couch and feel a knot in your stomach because you know what is coming in 45 minutes. I know how much it hurts to feel like you are breaking trust with the animal you love every single day just to keep them healthy. What I need you to hear is this. Your cat does not hate you. They are not being vindictive. They are not punishing you. They are running an ancient threat response program on hardware that was never designed for orange prescription bottles and kitchen countertops. And now you have the ability to speak to that hardware directly. The premedication protocol is not about tricking your cat. It is about meeting their nervous system where it actually lives, before the threat response fires, before the adrenaline hits, before the claws come out. When you walk into that room tomorrow with your shoulders down and your breathing slow, when you sit on their level and slow blink and let the bottle sit on the counter without drama, when you wrap them gently in the towel and follow the swallow protocol and offer the water syringe, you are not just giving medication more effectively. You are having a completely different kind of interaction. One where they can feel the difference between being handled and being cared for. That distinction is everything. I want to know your story. What is the most creative, desperate, occasionally genius thing you have ever tried to get medicine into your cat? Tell me everything in the comments below. Because I promise you, whatever you have tried, someone else has tried something more creative and probably more chaotic. And reading your stories might be exactly what another exhausted cat owner needs tonight to feel less alone. If this gave you something real today, something you are going to use tomorrow morning when that alarm goes off and you remember what comes next, please tap that like button. It tells YouTube that this kind of honest, research-backed feline education deserves to reach every cat owner who needs it. Subscribe to Paw Secrets Lab so you do not miss what is coming next. Because we are going deeper into feline behavior every single week. I am Dr. Maya Reeves. Prepare that towel tonight. Practice that slow blink. Your cat is going to feel the difference. And I will see you in the next one.